to shield sanitation, hygiene, immunization, education, and leadership for infectious disease prevention. Led by Millennium Fellows from Health Services Academy, this project provides essential support to children and families in some of Pakistan's most disadvantaged communities.
Our mission is simple: to improve the health and well-being of those who need it the most. By advancing key global goals like good health and well-being, clean water and sanitation, and reduced inequalities, SHIELD is building a foundation of hope and opportunity.
In Nurpur Shahan, a peri-urban slum in Islamabad, the community faces extreme poverty despite its close proximity to the capital. Through our project at Mashal Model School, we aim to create a lasting, positive change for children and their families.
Mashal Model School is a trust, which is a registered trust with the government of Pakistan. We started 17 years back. It was an effort to give education to the urban slum area children. So we chose Bari Imam. Started with one child. Now we have 750 children, girls and boys. It's a co-education system. We also work with children who are IDPs children, who are street children, refugee children, children with disabilities.
The school serves over 500 children, many of whom come from marginalized and undocumented backgrounds. These children lack access to basic health services, making them vulnerable to preventable diseases.
Empowering educators to pass on knowledge is critical for sustainable change. We began with educating teachers on nutrition, hygiene, mental health, and prevention of common infectious diseases. During the session, we uncovered critical issues like child abuse, labor, and domestic violence.
अक्सर छोटे बच्चे होते हैं, किसी चीज़ के खाने पीने की चीज़ की लालच में आ जाते हैं और उनके साथ ये सेक्सुअल अब्यूज़ लोग कर देते हैं। ALP क्लास जब हमने स्टार्ट की थी तो उस वक्त एक बच्चा था, तो उसके साथ ये सारा, क्योंकि वो बच्चा बहुत सेंसिटिव सा था और उसको जो है इस चीज़ के बारे में इतना अवेयर नहीं था शायद। वो शाम के टाइम घर से आया है, तो उसकी जो है उसके साथ ये सारा मामला पेश आया है। जब वो किसी शॉप पे गया तो उसके साथ किसी ने सब इसी तरह सेक्सुअल अब्यूज़ करके, तो वो बच्चा इतना टेंशन में 2-3 दिन क्लास में भी चुप रहा है। मेरे बहुत प्यार से फिर उससे बात की। फिर वो बच्चा बोला कि मैम मेरे साथ जो है, मैं शॉप पे गया हूँ तो एक बंदे ने मेरे साथ इस तरह की है। वो बच्चा टेंशन में था। मैंने फिर उसके पेरेंट्स को कॉल किया है, उनको इन्फॉर्म किया है आपके बच्चे के साथ अब्यूज़ हो चुका है।
We identified critical issues like child labor, abuse, and domestic violence. We held a session with parents emphasizing their role in their children's physical, mental, and social well-being, as well as the impact of parents' mental health on their children.
We held an interactive session with children, teaching hygiene through fun activities like hand washing to prevent diseases. We also covered good touch and bad touch, empowering them to protect them.
Our hygiene kits promote hygiene practices, reduce disease risk, and empower children for lasting health change. In tandem with our deworming initiative, benefiting over 400 children, we combat malnutrition and tackle essential health challenges in underserved communities, enhancing vitality, focus, and a brighter future for school-age children. Menstrual health is often neglected in underserved communities, leading to stigma and poor hygiene. Our sessions empower young women by breaking stigma, teaching safe practices, and debunking myths. We're conducting session evaluations to measure the impact of our health interventions in underserved communities. We conducted thorough research to evaluate children's nutritional health, enabling us to create tailored initiatives that cater to their specific needs. Our medical camp emerged as a crucial resource, offering essential health services and fostering community discussions.
We're not only implementing immediate health interventions, but also building a foundation for long-term impact. Through our collaboration with the school, we ensure that parents, teachers, and students have the tools they need to maintain these practices even after our project ends.
Shield, a group that came and they have told us a lot of things and made us aware of things. This is what we've done in the coming exams, the second term, where we have inducted that in our curriculum so that the children are able to answer the questions and they understand the concepts.
This is more than just a project, it's a promise to never abandon those who need us the most, to turn hope into action, and to ensure that every child, regardless of where they come from, has a right to a future filled with health and dignity.
The core values of empathy, humility, and inclusivity have been central to Project SHIELD, guiding every step of our work in the Millennium Fellowship. Team SHIELD is devoted to fostering a healthier, brighter future for children in underserved communities. With steadfast commitment, we have positively impacted over 500 lives, reaching countless others through our educational services and medical camps, creating a safer and more hopeful tomorrow.